Hi, Dr.
Hello.
Zeta.
Hi, I'm Debbie.
Nice to meet you. Okay, so what brings you in for a medical screening?
Well, I've been trying to try out for tennis for a while, and I need to have like a medical screening.
Okay.
Yeah, it's just part of it.
Right, okay. So I'm just gonna go over some questions for you to make sure that while you're being physically active that you'll be safe.
Okay.
Now, the first questions we'll go over will be yes or no questions.
Okay.
Okay. So now, within the past 6 months, have you experienced any of the following?
Okay.
A diagnosis of treatment for heart disease or stroke, or pain, discomfort, pressure in your chest during activities of daily living or during physical activity?
I haven't been diagnosed yet, but sometimes when I'm working out really, really hard, like my chest will start hurting and then I just stop. But like I haven't been diagnosed yet.
Okay, what do you mean by working out really, really hard? Like
maybe like the
sprints
peak, like the peak of my workout. So like when I'm warming up, I feel fine, and like leading up to like the hardest part of the workout is fine. But then sort of like when my arms are burning and I'm like running too much, like I get just like this pain in my chest.
Okay. Make a note of that there. Okay. How about a diagnosis of or treatment for high blood pressure or resting blood pressure of 160/90 or higher?
No.
No. Okay. Any dizziness or lightheadedness during physical activity?
A little bit. It's like part of like my chest pains almost. Like it hurts so much that kind of I get a little dizzy, so I have to sit down and stop, which is why.
Okay.
Yeah, I'll stop once I feel something.
Loss of consciousness or fainting for any reason?
No, I have not fainted.
You sure?
Yes.
Okay. Concussions?
No concussions.
Do you currently have pain or swelling in any part of your body, such as from an injury, acute flare-up of arthritis, or back pain, that affects your ability to be physically active?
Yeah, just like the chest again, you know, like it makes me, like I can't keep going once it starts.
Has a healthcare provider told you that you should avoid or modify certain types of physical activity?
No.
Do you have any other medical or physical conditions, such as diabetes, cancer, osteoporosis, asthma, spinal cord injury, that may affect your ability to be physically active?
No.
Okay. So now I'm going to ask you some questions to assess how active you are.
Okay.
Now typically, in a week, how many days do you do moderate to vigorous intensity aerobic physical activities such as walking, cycling, or jogging?
I would say I do a lot of moderate activity, but once I start getting to like that level where it's like a little, like maybe even moderately vigorous, my chest will start hurting and I have to like tone things down. So like walking is okay, but like working out a lot, or yeah, just getting to that point where I'm trying to get better, you know,
Okay.
I can't. It seems like.
How many days a week would that be?
Like 3?
About 3 days a
Yeah.
week. Now, days that you do at least moderate intensity aerobic physical activity, such as walking, how many minutes do you do this activity?
Well, I go to school too, so I kind of just like will walk between classes, and that's fine for me.
Okay.
So like, yeah, like 10-minute walk or so throughout the day.
Now I'm going to go over some general health questions.
Okay.
Now, has your doctor ever said that you have a heart condition or high blood pressure?
No.
Do you feel pain in your chest at rest during your daily activities of living or when you do physical activity? Yes, we went over that. Do you lose balance because of dizziness, or have you lost consciousness in the last 12 months?
I actually haven't, but my crazy story, my cousin actually has. He was working out one time and they don't know how he got a heart attack, but he just died. You know, they think it was because of him working out too hard, which is kind of scary.
Wow.
But it's never happened to me yet.
Okay.
So it's in my family, just not like not me.
Okay.
But yeah.
Okay. Have you ever been diagnosed with another chronic medical condition other than heart disease or high blood pressure?
No.
Are you currently taking prescribed medications for a chronic medical condition?
No.
Do you currently have or have had within the past 12 months a bone, joint, or soft tissue, muscle, ligament, or tendon problem that could be made worse by becoming more physically active?
No.
Has your doctor ever said that you should only do medically supervised physical activity?
No.
Okay. So one concern that I have is the chest pains that you get during your physical activity. And because of that, you are going to need clearance, okay, for your physical activity. So what I want you to do is actually go ahead and fill this out.
Okay. Is it just the... Oh, you mean this part, the personal information? Okay.
All right, good. So go ahead and talk to my secretary out there, and I'll set you up for a follow-up appointment.
Okay, thank you.
All right, thank you.
So much.